Hey everyone, and welcome back to Breathe Easy. This is episode 33, and today we're walking through our August Epic documentation updates. Some already went live August 3rd, and the rest will be going live August 17th, and they affect both our adult and pediatric patient populations. A little bit of background on how these came about. The August 3rd updates were requested by the Children's Manager of Respiratory Care, and then back in spring 2023, the Adult Manager of Respiratory Care requested other updates. They have been working their way through the build queue since then. Zach and I discussed with the Epic analyst on the build side, so when something looks different in your workflow, it's us putting the request into Epic for our respiratory bedside workflow. If you have questions about why a change was made, our managers are the best people to ask, and we're always helpful and happy to walk you through that, either Zach or myself. So the goal today is simple: know what changed, know where to chart, and know what to watch for when you're documenting at the bedside. Let's get into it. Here's a mental checklist before your next shift. One thing to keep straight is that this round has two different go live dates. So let me walk you through which is which. August 3rd is the group that's already live. That is the Children's Hospital ventilator updates, the removal of SBS from the PICU Extubation Readiness safety screen, and the Twill Tie showing up under endotracheal tube holder type. August 17th is the group coming up, and this is Respiratory Care's Airway HME update, the water-filled cuff terminology update, and the Passy-Muir Valve Status moving to a single multi-select row. If you're wondering why any of this matters today, it comes down to four things: less duplicate charting, clearer device selection, better visibility into airway and ventilator documentation, and more consistency from clinician to clinician. We will unpack each change over the next few slides. Both of these requests go live August 17th. The first one is Airway HME. You can now document Airway HME for patients with surgical airways. If you're not sure which HME type to pick, the row information in Epic gives you a description of each one, so use it. That is exactly what it's there for. For example, if my patient has a Larry tube HME and I, as the respiratory therapist, change it for its daily change, I will select laryngectomy HME and changed. One important reminder here is that currently manual occlusion HME and automatic occlusion HME are not available for inpatient use at this time, so you will not be selecting those on our units. The second adult update is the cuff terminology. This had been requested a while back. The wording has been updated for water-filled tracheostomy tube cuffs so it lines up with Epic's standard documentation language. Nothing about your practice changes here. It's the language you are selecting that changes. So instead of number CCH2O, it says water instilled in cuff in mLs. The teaching point for both of these is the same. If you're ever unclear, pause and verify the actual device or cuff type before you chart it. It is much easier to get it right the first time than correct it later. Next up, Passy-Muir Valve Status. Starting August 17th, this becomes one multi-select row instead of two separate entries. So you can capture both the current status and the valve type in the same place. Here's what it looks like in practice. Say your patient has a purple Passy-Muir valve, but they're not using it right now. You would select not in use, and you would also select purple, both in that one row. That is a whole change. And while we're on airway devices, our Children's Respiratory Care Manager did request for Twill Tie to be an option under endotracheal tube holder type. This one went live back on August 3rd, so it should already be showing up for you. If Twill Tie is actually what is securing the airway, that is what you select. So for the Children's Hospital side, there were the three updates that all went live August 3rd, so you may have already noticed them. First, ventilator documentation. Ventilator weight and tidal volume per kilogram now auto-populate for you in the ventilator documentation. Second, the PICU Extubation Readiness safety screen, the SBS row, has been taken out. Everything else in that screen stays exactly the same, so keep completing the remaining criteria the way you have been. Third is that endotracheal tube holder type we've already discussed about the Twill Tie being added as a selection, so that's what you pick if it's being used. If there's one message to take away, it's fewer manual entries and a cleaner airway documentation, and we'll look at the first two here a little bit more in detail. Let's look a little closer at the ventilator auto-population. For Children's Hospital, ventilator weight and tidal volume per kilogram fields now fill in on their own in a ventilator documentation section. The rows to look out for are weight for Children's Hospital exhale tidal volume ml per kilogram calculated, and Children's Hospital spontaneous ml per kilogram calculated. Those calculated rows are the children's specific ones, so that is where you will see the change. Here's the part I really want to land. Auto-populate is a prompt to review, not a reason to skip past it. Take the extra second to look at the value and make sure it makes sense for your patient. And if something looks off, go back and verify the source data rather than forcing the documentation through. The calculation is only as good as where it's pulling from. This is the PICU Extubation Readiness safety screen, and the change here is a removal of SBS is no longer one of the rows that is used in this screen. This is not currently being utilized by Children's Hospital, so that request had been placed for this update. So the takeaway is short: don't go looking for the SBS in the section, and do not consider the screen incomplete because it's missing. It's simply not part of the row set anymore. This is a brief overview, and it's nice and straightforward. Under endotracheal tube holder type, you now have the Twill Tie of its choice alongside the commercial adult, commercial neo, and tape, and this already went live August 3rd. Let's put it all together. 6 changes and 2 dates. Coming August 17th, Airway HME is available for surgical airway documentation. So lean on the row information to pick the right type. For example, a standard HME is what we consider usually a nosy, or what respiratory therapists call a nosy. The water-filled cuff terminology is now updated from the Quest in 2023, and the Passy-Muir Valve Status becomes one multi-select row that captures both the status and valve type. Already live since August 3rd, children's ventilator weight and tidal volume per kilogram auto-populate, and remember to review those for accuracy. SBS is gone from the PICU Extubation Readiness safety screen, and Twill Tie is an option under endotracheal tube holder type. If you only remember one line from today, make it this one: document the right device in the right row using the updated option selections. Thank you for tuning in to Breathe Easy, episode 33. Next week, we head back through our A through F bundle series. Stay safe, stay curious, and keep helping our patients breathe easy.